Well, woman screenings. Leave the fear behind. There are many things we cannot control in life. However, we have the power over ourselves. You have the power to make lifestyle changes and control your health. But how do we do it? By staying healthy, seek preventive care for breast screening and pap exams in your 50s and over. It is inevitable, but will happen even if it's welcome or not. Women will experience menopause. The average age to start is 51 years old. The most common symptoms are hot flashes, vaginal dryness, and urine leakage. You will also develop bone density decrease. According to a study conducted in Los Angeles to a group of Hispanic women of 603 participants over the age of 50, was found that a very low percentage seeks preventive care by the age of 55 and up. The study also found that the majority of the participants had limited education as far as 8th grade. These participants would fall under the low-income category, and more than 50% were widow. The conclusion was that the majority was marginally acculturated. This was a conclusion by Bundeck, Marks, and Richardson. But why Hispanic senior women do not get screened? Because of income restriction, the limitations and the cost of testing concerns many and may not be able to afford it. Education limitation. Many had low, limited education and are not literate. Language barrier. Spanish-speaking community lack confidence and openness to speak up about their concerns. Insurance coverage. Costs are also confusing to many, and the fees that are involved with coverage or non-insured scares them. And lastly, employment. Many still have a job and aren't able to miss work, or may feel that could lose their job if they do. Many women have the wrong concept that it is not necessary to conduct preventive well exams. I found these myths and facts that were obtained by a study from Austin, Amack, McNally, and Stewart that the following was found. If it's not broken, then there is nothing to fix. If you do not have symptoms, then I am perfectly healthy. If you do not have a family history, then you're not going to get anything. Feeling embarrassed to show their private parts to doctors, especially if they are males. Many felt shy to even speak about the topic or even saying the proper body part names. Religious beliefs were also important, and many felt that they would be punished by God if they even had someone looking down there. Lastly, many were just fearful to know the truth if they obtained or became positive for testing. But what causes cancer? Many say exposure to the hormone estrogen at such early age or supplemental hormone therapy replacement is more likely to develop breast cancer. Heavy smoking and daily alcohol intake or even the abuse increases your risk to develop cancer. Sedentary physical activities and poor eating habits, especially in fried foods, high saturated fats, childbearing at an older age. And if you're genetically open, sometimes it's just genetics. Do not fear to get screened. You're not alone. Do not wait until it's too late. What can we do to avoid this? Well, the most important one, the first rule, early detection provides more chances to treat any presence of cancer. That way, if you find it at an early stage, it's easier to treat it. Hispanics overall rate is low but there's still a high risk because by the time cancer is found, it's already advanced. Nearly 300 deaths a year are due to cervical cancer in the Hispanic community. That's 1 in 6 Hispanic women. Women after 50 years old are at higher risk, but after 65 are at the highest. So do not think that because you no longer have periods or symptoms, or you're not even sexually active, it's not necessary. So let's spread the word and tell our friends the power is in you. Remember, 1 in 6 Hispanic women are likely to find cancer too. Women of 6. And remember, the power is within you, not the chancla. Let's spread the word and tell our friends that the power is within you. So with my health belief model, I wanted to seek an awareness for elderly Hispanic community to be open to the new preventive modes. And there's many outreaches and many possibilities for them to get tested. Wanted to make sure they're aware of all the resources for them, and that if we don't take action, then they can lead the consequences. And we don't want to wait for them to receive bad news on the last minute.